All right, let's start off with the VA's website. There's a link to this page in the description so you can follow along. So, what they do is they ask the question, what VA dental care benefits do I qualify for? And then they have these scenarios that they open up and down. So, I have service connected dental disability or condition for which I receive compensation monthly payments. You're in class one. You may qualify for any needed dental care. I opened up the rest of these just for the purpose of speed. If you're a former POW, you're in class 2C and you may qualify for any needed dental care. It's always you may qualify. There's always something holding things up. So that's what I'm going to go with as well. You're going to have to research and find out exactly what class you fit into and if you do actually qualify. So you'll want to call the VA for that. I have one or more service connected disabilities rated 100% disabling. You're in class 4. You may qualify for any needed dental care. Please note if you're being paid at the 100% disabling rate based on temporary rating for a reason such as a long stay in the hospital, that doesn't qualify for you for this. So this is for if you have surgery on your knee or something like that and you're a temporary 100%, you don't qualify. If I'm unemployable, unable to work, and I get disability compensation at the 100% rate due to service connected conditions. This is TDIU. You're also in class 4. You may qualify for any needed dental care. I served on active duty 90 days or more during the Persian Gulf War. You're in class 2. One-time dental care if you meet all the requirements listed below. You didn't receive a dishonorable discharge. You apply for dental care within 180 days of discharge or release, and your DD 214 certificate of discharge doesn't show that you had a completed dental exam. I have a service-connected non-compensable dental condition, a dental condition that you're not getting disability payments for, or a disability that's the result of combat wounds or service trauma. You're in class 2A. You may qualify for any dental care needed to make sure you have and keep a functioning dentition. That's a fancy way for saying a working set of teeth. So, what VA's definition of a working set of teeth is beyond me. Maybe one tooth or something like that. So, you're going to have to look into that one. A VA dental care provider has concluded that my dental condition is linked to a service connected health condition and it's making that condition worse. This one, you're going to be in class 3. Dental care to treat oral conditions that a VA dental care provider concludes are directly making your service connected health conditions worse. So this is where you get into secondaries. So if your, current service connected disability is made worse by your serious gingivitis or gum disease or whatever you're dealing with in your mouth, you may qualify for class 3. If you're in Chapter 31, VOC Rehab or Veteran Readiness and Employment Program, they do a little bit for you there as well. Class 4, basically they lay out a bunch of goals. And if you're in it, they want to make sure that your teeth are good enough so you can make it through the employment program. So you're not in pain all the time and you can actually complete the program. Then they'll also work on your grill for you to reach your goals after you get through the program. So if you're going to school and then you're ready to go get a job or whatever, they'll take care of you that way. So if you're in VR&E, I would look into this, and this one looks pretty easy to get into if you're in the VR&E program. I get VA care or am scheduled for inpatient care for a health condition, and I need dental care for a dental issue that's making my health condition harder to treat. You're in class 4, dental care to treat the dental issue that a VA dental care provider finds is making the health condition you're treated for harder to treat. If you're signed up through the Homeless Veterans Dental Program, which is VHA Directive 207-039, you're in class 2B. You'll get a one-time course of dental care if you qualify. And it's funny what the stated goals is. If it relieves your pain, they'll do it. If it helps you get a job, they'll do it. If it helps treat a moderate, severe, or complicated or severe gingivital or periodontal condition, which are gum infections that lead to bone and tooth loss if not treated. They'll take care of you if you're in the homeless program. I'm currently get inpatient care in a hospital, nursing home, or other supervised home-like care setting called domiciliary care. If you're in inpatient status, you may qualify for dental services, and then you have to work with your primary care provider, and they have to, make this conclusion that you need to have dental care. So now let's go hop over into something that actually makes sense, because all these little check boxes are just another bullshit way. It doesn't really break it down, like, oh, this one's in class 4, this one's in class 3, this one's in class 2A, this one's in class 2. So here's class 4. So they're all out of order. Class 4, class 2C, class 1. So it's just these bold statements, and you have to click on the plus button, and it's like, gee, I wonder if I fit into that. So let's hop over to a little easier version of this, and we'll do that now. All right, this way it makes a little bit more sense to me. I'm not going to read everything, but it's a little easier to look at. So, Class 1 dental care. Veterans with service-connected disabilities or conditions for which they receive compensation, monthly payments are in Class 1. Veterans in Class 1 qualify for any needed dental care. Class 2, this one covers Persian Gulf War era veterans, but there's qualifiers. You didn't receive a dishonorable discharge, you applied for dental care, and you have proof that you didn't get a thorough dental exam when you exited. Class 2A dental care. You have a dental condition that is 0% service connected. That is a result of combat wounds or service trauma. You're in Class 2. To prove the combat wounds and service trauma piece of this, you're going to need dental trauma rating, VA Form 10-564-D, and or the VA Regional Office Rating Decision Letter, VA Form 10-7131, to prove this and make sure you meet this criteria. Class 2B dental care. This is the Homeless Veterans Directive that I talked about, and I basically already talked about this one. Class 2C dental care. This one covers POWs. Class 3 dental care. You may qualify for this to treat the oral conditions that a VA dental care provider concludes are directly making your service-connected health condition worse. Covered that one. Class 4 is the biggest one. Service-connected disabilities rated 100% disabling. And then it also covers TDIU, but it does not cover if you're temporarily 100%. And by the way, the orthopedic conditions, musculoskeletal conditions, they changed the way they rate that. So it used to be you get paid temporarily at 100% for a year. Now they knocked it down to 4 months as of February 7th, I believe. But regardless, you wouldn't get dental care regardless of how long that's for. Class 5 covers the VOC Rehab, the Veteran Readiness and Employment Program. And then Class 6 is for inpatient health care. And this one's if you're inpatient, you're already checked in, and it's hard for them to fix whatever's wrong with you, and you need some dental care to make that better. And then the last one here is the VA Dental Insurance Program. And this is what most veterans qualify for. You may fall into one of these 6 classes or these subclasses, but most veterans with like a 30% rating or a 60% rating don't qualify for VA dental care. If you're over the 50% mark, you're going to get everything covered, your copays, your medications and stuff on the doctor's side of the house. But the dental side of the house, you're most likely going to have to go under the VA Dental Insurance Program. And you're going to need to look at the different qualifiers for that. Google it. But this is the one that most of us fit into. This is where I was at for a long time before I achieved 100%. That concludes my lesson today on VA dental care and some of the issues with it. If you're not aware of which class group you're in, I would call the VA 800-827-1000 and just ask them, and they'll tell you that way. Let me jump in here real quick and tell you about my boot camp. If you want to learn more about the VA claims process, check out my boot camp. You can talk to me live. There's a link on the website and in the description, combatcraig.com. And also, if you need medical evidence like a nexus or documenting your symptoms properly, go to our website, combatcraig.com, and it says medteam/nexus letters. Click on that link, fill out the form, boom, you're done.